All right, hello everyone. My name is Briaunna Flint. I am in Social Work 200 during the summer semester 2020. And I was assigned Chapter 7 with healthcare and health challenges. I made bullet points, so I'll be looking down at my bullet points to reference everything that I'm saying. So we have 4 things that we needed to talk about for this assignment. One would be the specific barriers and social inequalities faced by the populations. So for my chapter for healthcare and health challenges, some of the barriers would be health and illness, people understanding what health is and what illness is, like the physical, mental, and emotional well-being of a person all around, and then illness is the lack thereof of that well-being. Another barrier would be how social workers are vital with helping people understand and comprehend what doctors are saying. That could be a very big barrier, because I know when I go to the doctor, they're using large medical terms that a lot of people won't understand, or that you got to look up yourself for you to be able to understand, because doctors don't really go into detail about certain things. When it comes to like explaining a health condition to a patient, they'll just tell like, oh, you have this and this is what you need to do to treat it, or this is what you need to do to cure it. Another barrier would be helping them fully understand situations, helping them with recovering and things like that. Another barrier would be financial, being able to pay bills and going into bankruptcy from not having health insurance. Another barrier is like diversity, race, ethnicity, class, age, gender, and sexual orientation. A lot of people may be discriminated against when they are faced with these challenges and they need help. People are reluctant to help them because of these differentiations. And then people who have these intersectionalities that may be very young, they may be, say, like a young person that could possibly like 19 years old, they are a lesbian, and they don't have a gender, or they don't conform to gender norms, and they are Black. It might be someone who looks at them and says, well, they go against something that I don't agree with, so I don't want to help them. That could be a very large barrier. Also, confusing healthcare policies. A lot of people don't necessarily go through handbooks and read the fine print of healthcare agencies or healthcare providers when they are being serviced by them. They just know like, oh, I'm approved for it. I'm able to go to the doctor, get my prescription paid for, and my doctor's appointment paid for with no copay. That's awesome. They don't really read the fine print and see what they're covered for, the things that they can do, and how far they can go, or how much they have in being able to be covered by healthcare. Also, the social inequalities, like African Americans, Latinos, Asian Americans, Pacific Islanders, Native Americans. Those are people who in America are oppressed and impoverished, like people who live in poverty, people who are poor, lower class. They also can be discriminated against or have lack thereof of healthcare, or have the lack of knowledge of how to get healthcare, or where to start with getting healthcare for themselves and their children. And it's very stressful. It's very, very stressful when you are uneducated on these things, with having so many different health conditions in these communities, and not being able to fully understand what's going on. So that's where social workers come in at, to help them to communicate with them. Those are the barriers. The second one, the historical and current policies and actions that have shaped the inequalities faced by the societal perceptions of your population. So I had healthcare and health challenges. So hospitals really came around during the Civil War. They were like, they started being dominant in the Civil War. And like the first health insurance came around in 1930, like right after the Great Depression, to help people pay for medical bills. And it was Blue Cross Blue Shield. And eventually they separated into different organizations in 1992 and 1939. And in 1982, they emerged into the insurance company that they are today. Over the course of health insurance, it was given to people who worked full time and earned more than minimum wage, and it was covered. They were covering, their children were covered up to the age of 26, I believe. No, I don't think their children were covered. But they said, from the readings that I did, they said that healthcare has came a very, very long way, because not being able to pay for services made people go into bankruptcy, made people do things that made people go broke. A lot of people are living in poverty because of medical bills or medical debt. But insurance companies came in and reevaluated like the whole I pay you and I do you a service and you pay me situation. So they became a third party payer. So the person who was receiving the service from the hospital was the first party in the hospital wanting the payment. The third party person will come in and pay them, while this person paid a certain amount monthly or whatever the situation may have been. But over time, like, it's been mandatory for everyone to have health insurance with the Affordable Care Act, or as known as the Obamacare Act. And that also goes with the, what is it called? I'm going to flip through my book because I know what it's called. It is the Medicare Part D Act, where you can't be denied health care due to a pre-existing condition like asthma, cancer, HIV, or AIDS. And I feel like those are very important and prominent aspects of healthcare, because those are things that healthcare agencies are look at like, oh, that's going to cost. Like, that's something that's going to cost us a lot of money, and it's not beneficial for us to serve this person because they're more expensive than a person who doesn't have these diseases. So the medical Part D was very, very important to have in the United States, and I feel like that brought us a long way with children having diseases that they can't control, especially with older adults who have these progressive diseases that get worse over time. And I feel like, okay, so we're going to go to number 3. Advocacy efforts led to promote both systematic and individual change within populations highlighted in your chapter. So the advocacy effects include insurance being affordable and accessible to all, HIPAA also coming into effect, as well as Medicare Part D and the Affordable Care Act, like I just mentioned. And then also like hospitals provide better care to their patients. The veteran healthcare system, veterans are required by law to be provided eligible hospital care, as well as race and class impact, making it better for African Americans and other people of oppressed or impoverished living conditions, making it better for them to have making it better for those who have diseases and illness to be able to receive the care, and also to eliminate the infant mortality, not necessarily eliminate, but decrease the infant mortality rate in hospitals. So it's like people who don't have health insurance, they aren't treated as those who do have health insurance. They're not given the proper care or the proper attention that they need because of a financial issue, and that's not really necessarily fair. When if you have the resources to help a person, that they should be able to receive the help. So if everyone has health insurance, nobody should be treated differently. But there are different situations, different biases, different things that people, diversities that people see when they look at a patient or when they look at someone and see like, oh, this person doesn't need this help or this person does need this help. And it really affects people of color, because people of color have higher infant mortality rates and heart disease and hypertension and things like that because of the care that they're not receiving. And that's where social workers come in. They help them receive the care that they need, help them with maintaining risk and preventative measures. And the 4th was social workers' roles and careers to support the population. Social workers play an important role in helping people first understand doctors, helping them with preventative measures and showing them risk factors and things they shouldn't and should do. They also help with managing stress, time management, keeping a routine, and they also help with being able to listen and communicate better with individuals. And they also provide a lot of support and advocacy for people who are ill as well as sick. So it's like being a social worker, you have all of these things that you are responsible for when helping a person, and it's just like you're doing everything in your power to make sure that this person is provided with everything that they need to be able to live a healthy, well life. And that is all. Hope you guys enjoyed the video. Hopefully I was able to enlighten most of you on some of these issues. Hopefully I was able to explain things where you have a better understanding about health care and health challenges with oppressed people who have been oppressed, people that live in poor conditions, people who are uneducated, and the work that a social worker can do to help these people. All right.